and welcome to Flourish and Flow. I'm your host, Amy Rohrer from the Yoga Hut in Tillsonburg, here to help you connect and integrate the dots to true wellness on your healthy living journey. If my own healing journey has taught me anything, is there is no one-size-fits-all approach to flourishing. We are here today at Hometown Style in Ingersoll. They are one of our show sponsors, so a big thank you to Jen for welcoming us here to film the show in this beautiful studio space. And a big thank you to our additional show sponsors, Bree and Kyle from Bree's Fresh Market and Laura from Escape Salon and Spa. On today's episode, we are joined by Dr. Spiro Ioannidis. He is a dedicated chiropractic neurologist with U.S. board certification who has dedicated his career to helping patients overcome complex conditions such as concussions, dizziness, and dysautonimias. With a unique blend of advanced neurological training and hands-on chiropractic experience, he brings both expertise and compassion to restoring patients' quality of life. So thank you so much for joining me here today.
It's my pleasure. Thanks for having me.
Yeah, I'm excited to get to chat more about all that you do. So tell me a little bit more about you becoming a chiropractor and what led you into then studying chiropractic neurology.
Sure, great question to start with. Basically, I knew from a young age that I wanted to be in healthcare. I just didn't know where. I thought about medicine, dentistry, so I investigated. I ended up volunteering at the hospital. I ended up actually going and seeing some dental procedures being performed and quickly realized that it was not the fit for me. So I actually, at that time, I was in high school and my brother introduced me to chiropractic. It was a good friend of his brother who actually was a chiropractor out west at the time. And he was telling these amazing stories about healing and helping people with conditions without using any procedures or any medicine. And that really piqued my interest. So I thought this was interesting to me. And I pursued, investigated, and that's kind of how I got interested in chiropractic.
Okay.
So the pivotal point in my career was actually meeting Dr. Carrick, who was the father of functional neurology. He was credited with getting Sidney Crosby back on the ice after he had a concussion. And basically he was speaking, I was studying in Dallas, Texas at the time, and he was speaking at a conference there. And he really resonated with me. He was treating complex neurological conditions, and he was using research-based methods, and it made sense to me. I really wanted answers to the treatments we were providing, and he was able to give them to me.
Interesting. Okay. And so maybe speak a little bit more about what chiropractic neurology is, because that is unique to Canada.
Sure.
I remember when I looked you up, where I was researching more about this myself, I think there's only 40 chiropractic neurologists in Canada with that certification. So yeah, speak a little bit more about what that entails.
Sure. So chiropractic neurology has some specialties in the U.S. With me, I ended up having the interest in neurology, of course, like we discussed. And it's a 3-year program after postdoctoral, so after chiropractic school, in which we study the nervous system, the brain, and how to treat it. What's different and novel about it is that we're not using medicine, we're using receptor-based therapies to target the brain and finding out where weaknesses are. It's quite complex. There's a lot of technology involved and a lot of quantitative data that we get. We like to use things like VNGs, which are video nystagmography, where we actually assess the vestibular system and ocular motor function in order to find out how the brain stem is doing, along with testing like reaction time testing, where we're looking at a light board and seeing and comparing peripheral reaction times to central reaction times, which is also diagnostic. In computerized posturography, which is just a big name for balance testing. But we get to discern whether the issues are central, whether the vestibular system is involved, the proprioceptive system, or the visual system. So we get a lot of answers there. So with the assessment, we find areas that are weak in the brain. And not unlike a physical therapist would treat a weak muscle, we end up treating areas of the brain that are not doing so well, using these exercises like vestibular exercises, vision therapy, balance training with feedback, and kind of targeting these areas. And it's based on the principle of neuroplasticity, which a lot of people know about, which basically is rearranging and connecting synapses in the nervous system to make things stronger and reconnect after injury, or even just to learn something new. We see this process.
Wonderful. So something that you said, targeting these weaknesses in the brain. Maybe you could speak to a few of the reasons or the common conditions that can cause these weaknesses?
Sure. Well, one of the biggest ones we see a lot of is concussion and post-concussive syndrome. So with head injuries, we get a lot of rotatory forces in the brainstem. We get injury to these neurons, and there's axonal shearing, and these connections are lost. So we don't get a lot of good communication between the systems like the vestibular system and the brain, and kind of knowing where we are in space. So that's what we're treating. There's people that have dizziness. There's people that have vertigo. We see a lot of Meniere's, and we see a lot of post-viral issues that cause imbalances in these systems. So the assessment tools are important.
Right. Wonderful. And if I am correct, you have just moved offices. You have a new location with some exciting new equipment. So tell people a little bit about where you're located.
Sure,
what's your vision for your new space?
Well, I'm very excited about it. I was in a small area, in a small space in another location, just moved, like you said, to about 2,300 square feet. So there's a lot of space to grow. And my vision is actually to get a team that are of doctors that are passionate about what I do, and which is healing the brain and kind of getting this type of therapy on the map within London and even in Ontario, where people can come and get everything they need in one spot with respect to healing their brain and recovery. We have a lot of equipment, like you mentioned. We mentioned a couple already, the VNG, which is the video nystagmography, which records, it's the gold standard for basically vestibular testing and balance assessment. We have the NSI, which is a neurosensory motor integrative tool where we can treat cognitive issues and vestibular issues. It's an interactive touch screen. We have the Dynavision, which is a reaction board that measures the reaction times. It's a diagnostic, but it's also therapeutic. And what the beauty is we can treat people with severe neurological conditions. An example would be Parkinson's, and try and help them along their way. But we also can treat high-level athletes and just increase their performance on these modalities. So there's a lot to do, and yeah, I'm very excited.
Yeah. And so you said building a team, like what's your vision for what some of the other practitioners might be?
Sure. So I think physical therapy has a big role in these, I believe, these cases. Naturopathic doctors do. Maybe an osteopath. We want massage in there. We want somebody to relax people. That's kind of the thought at this point.
Yes. So you mentioned concussions being, a popular reason that somebody might eventually find their way to you. And I think those post-concussion symptoms are more common than people think. And I know I've talked to you about that before. Like it could be a concussion from when you were a kid, and slowly things get worse over time. What's often misunderstood about the recovery process, and how do you support patients differently?
Well, I think a big part of the misunderstanding comes from the actual families that are involved with the people that have these injuries. Something unique about concussions is you can't really see the injury. If somebody fractures their leg or their arm, they put a cast on, everybody's sympathetic or empathetic, and we know they have a problem. With head injuries, it's a little bit deeper, right? It's subcortical. There's issues with the brainstem. You're not seeing these problems. We can see it in the eyes when we evaluate myself, but people don't understand that there's a lot of light sensitivity, there's a lot of sound sensitivity, there's fogginess and headaches, things that we can't really see or quantify, and people don't get the care that they expect they should get. They don't get the attention from their family members sometimes, so it's a little challenging.
Yeah.
So we bring light to that with the tools we have.
To kind of normalize like that this is all connected, and help people move forward. So thank you so much. We're gonna chat more after this short break. We've got lots to still unpack, so stay tuned. We'll be back soon. Welcome back to Flourish Flow. I'm here today with Dr. Ioannidis, and we are talking all things balance, brain function, vestibular issues. So I think that's something that maybe would be good to dive into, because when you say vestibular system, I've only recently started to learn more about that, but that is a common thing that you treat. So maybe if you could give us some insight as to what that all entails and how you work with someone's vestibular system.
Yeah, that's great. So it's good to talk about. So the vestibular system is involved in a lot of balance disorders and problems with balance and feeling dizzy. So it's important to understand kind of what we're looking and assessing, and that's part of the V&G assessment, is looking at the vestibular system and the oculomotor function. Balance is super important. Knowing where we are in space, knowing where space is around us is super, super important. If that's working well, all the other stuff comes along nicely.
Right.
What makes us feel grounded in knowing where we are in space is 3 systems. In balance is a multimodal system. It's one of the few in the central nervous system that's like that. Vision, smell is kind of, you smell, it goes straight to your frontal lobe. Your vision is similar. Balance is different in that you have 3 systems involved in knowing where you are in space and staying balanced. It's the vestibular system, the visual system, and your proprioceptive system. So these 3 together, they integrate into a hub, we'll call it, into the brainstem, and kind of give answers as to where we are in space and keeping us upright against gravity. The vestibular system does many things, and we'll start with that one. It allows you to keep targets of interest balanced and fixed when you're moving your head, so you're not seeing things bounce around while you're even walking.
Right.
So a good example I like to use is basically the camcorder, those scary movies back in the day where somebody would be running through the forest and you see the video and the whole vision, the whole thing's shaking around. Well, basically, if our vestibulo-ocular reflex, which is the system that the vestibular system connects with the eyes, if it's not working, that's what we would see. It's a lot of oscillation. So looking at something, when you turn your head moves equal and opposite to your eye movement, so everything's balanced and steady. So that's one of the main things that the vestibular system does. Secondly, it controls smooth eye movement. So your ability to track something is your vestibular system working properly. The third thing is basically telling us where we are in space. So it starts with mapping your head, telling you if you tilt off axis, if you've rotated, so you can actually know where your body is. So that's a lot of work. The vestibular system does a lot of super important things to kind of keep us grounded. The other system to keep us balanced is the proprioceptive. So basically, in our ankles mainly, we have receptors that kind of give us feedback into the brain, into the cerebellum to keep us balanced. And then vision. So vision is about 10% of our balance. So three systems, the proprioceptive, the vestibular, and the visual system together tell us where we are and keep us balanced. When there's something wrong with one of those systems, we have issues with balance. We can feel dizzy. We can have sensory mismatches, and kind of the car sickness example is a good one.
Right.
If things aren't matching, so your visual system's telling you you're approaching something at 20 kilometers an hour, and your vestibular system disagrees, it says, no, we're moving at 15, you're gonna feel nauseous, you're not gonna feel well. So it's important that all these systems work well together. So when you're standing on the floor, 70% of your balance is mainly coming from your ankles. If you're walking on the beach, it's basically flipped. So 70% of balance is your vestibular system telling you where you are. When we test, we get people on foam cushions and on firm, and we get quantitative data on this computerized posturography we talked about. So we're basically able to discern where issues are coming from with these balance problems. So if your balance is poor on the foam, we kind of know the vestibular system's not doing so well. Then we compare that with the video oculography, or the V&G testing. So we'll see things that are similar in the eye recordings that correlate with the testing in the balance. So we get a good idea of where problems are coming, so that way we can target them and help and fix things.
Well, so much there that you
It's a lot of
shared.
information.
Yeah, thank you though, because I mean, I think it's important. There's, vertigo, dizziness. There's lots of people who struggle with these symptoms and have a very hard time getting answers. And I know, like, my husband did come to see you, but, he went to see 2 ENTs, and it was kind of like through those tests, like, no, everything's normal. But, sometimes it's those late stages that would show up on a test like that, and you can really help detect some of those finer details that might be contributing to somebody's
That's right. There's more digging to be done. You got to dig a little deeper, and if you have the technology to do so, you get answers. And it's nice to see, because I'm always happy when I have patients sitting across from me smiling and saying, I've been told this is my new normal. And I'm saying, this is why you're feeling the way you're feeling, and we can actually see it.
That's huge.
So when you have a graph and you see that the sinusoidal curve is not smooth and there's jumps, they can relate to that, and they're like, yeah, I feel that. And now they can see it, and it enlightens them, and it gives them some hope. And that's what we're here for at the end of the day, is changing people's quality of living. I always ask patients, what are your goals? Because it's not, for me, it's not important that their eye moves fast or smooth, is what does that mean for them in real life, which is going to be getting, for some patients, it's I want to ride a bike with my daughter again, and our goal is that.
Yeah.
So obviously the eye testing cleans up as we get better, but if it cleaned up and they can't ride their bike, it's meaningless. So it's about getting them back to doing what they're doing. And for some people, it's just independence and, having control of their life again, just being able to do simple things.
Yeah.
So that's what we strive for.
Well, and that helps inspire people to do the exercises, do the work, and like have that vision for why they are coming to see you, and that hope for the future. It's important to have. The
exercises are sometimes trivial and they're simple, but it's knowing what to do, when to do it, and how often to do it that matters.
Yeah.
So it's good. It's a good feeling getting people back on their feet again.
Absolutely. So something that you also mentioned, or I mentioned in your bio, that you often see as well, is dysautonomia. So if you can explain what that is, how it can affect everyday life in ways we might not immediately think about being connected to the nervous system.
Yeah, that's a big one. We're seeing a lot more of this coming into the clinic. I think part of it is more awareness of the problem. And basically, dysautonomia means that there's a dysfunction in the autonomic nervous system. The autonomic nervous system is basically the balance between the parasympathetics and the sympathetic tone in the body. Most of us will have heard of it as a fight or flight or a rest and digest mechanism. So your sympathetics is what will be triggered when you're trying to survive. Something scares you, you're getting chased. There you go, which happens in London sometimes. You have dilation of your pupils, your heart rate goes up, your blood pressure goes up, your central vessels constrict so you can fight or flee. Parasympathetic is quite the opposite. If you see a bear chasing you, you're not going to want to eat a sandwich.
No.
It's resting and digesting. So your parasympathetic is going to be active when you're eating, when you're relaxed. So basically with dysautonomias, there's an imbalance. POTS is probably one of the most common ones we're hearing and seeing, which stands for postural orthostatic tachycardia syndrome. Essentially, you stand up and what's supposed to happen is your blood pools, your heart reflexively responds by increasing its rate, and then your central vessels constrict and your heart rate goes back to a normal beat. In dysautonomias or POTS, for example, we have a lack of that central vessel constriction, so it's almost like you're more parasympathetic.
Right.
Your vessels are dilated still, so you have pooling, and you will just be standing, and your heart rate would possibly get up to 140 beats per minute. It's pretty dramatic.
This leads to cause somebody to feel
I was going to say, it leads to feeling dizziness, fogginess, your heart's racing, you have chest pain. You just don't feel well at all, and nobody really knows why. When we look into this and we do the testing and we use tilt tables to evaluate, we quickly find that there's a reason that they're feeling that way, because it's not normal to stand up and not do anything and be tacking at 140 beats per minute from 60 laying down. So in the assessment, that's one of the things we do is look at blood pressures and heart rate from sitting to standing. And then we know that the central system that's involved is in the brainstem, particularly the medulla, where there's an area called the NTS. That's most oftentimes the culprit in not allowing for that central constriction to happen. And we start training the brainstem and doing those exercises that we've found in our testing to start giving better integration into the brainstem and better function. So we get that response, we get that central constriction, and we get the blood pushed up, and now the brain's not asking for help from the heart to function.
It's fascinating, how you can really help, paint the picture for some of these symptoms that people maybe have been living with for years and not realizing, how standing up and feeling dizzy or fatigue could be connected to,
it's a big deal, and it's very common in concussion. Patients will have POTS conditions, diagnoses, because the central structures are in the brainstem. There's a lot of rotation in concussion. It's almost like wringing out a wet towel. The central part of the towel has all the stress. Same thing happens to the brainstem, and because those structures live there, we get injury to the autonomic nervous system. So ocular motor lives in the midline of the brainstem, so does the vestibular or the autonomic tone. So we see these conditions with concussion, and a lot of times the post-concussive syndrome is because they haven't noticed that there's a dysautonomia with the concussion. So I'll have patients 3 years out coming to see me, and we find that, okay, they're having this POTS response, this tachycardia. And if you don't fix that, you're not going to heal the brain because you're not getting blood flow. Right. You're not perfusing to the brain because of the lack of integration. So the first order of business is to fix the autonomics. And it's almost always the case if you have a complex neurological condition, is to fix autonomic function, make sure blood's going where it's supposed to, when it's supposed to go there. So we have blood flow and we can heal when we have oxygen in the brain. The exercises get somewhere. Otherwise, you're just fatiguing people.
Yeah. Well, you help to bring in the missing pieces and help people, finally get some answers that they've been hopefully, looking for a long time. So we are not letting you go yet. We're going to go to a commercial and then we will chat more soon. So stay tuned.
Thanks.
Welcome back to Flourish Flow. We are here today with Dr. Ioannidis, and we are talking all about chiropractic neurology. We mentioned that you have a brand new facility, Cerebral Health and Spine Care. So is there anything you want to share about that? It's not just the neurologics, you also offer other services.
That's correct, yes. So we do focus on complex neurological cases like we've been discussing, but we also do spine care. My licensure is chiropractic and we see spine patients. We're offering advanced laser therapy treatments. I'm actually very excited about the laser therapy that we're doing. It's cutting edge, and also we're going to be bringing in spinal decompression, which I think is important for those patients that are having the persistent sciatic pain and are not getting relief from just the traditional chiropractic manipulations provided. So,
okay, wonderful. Yeah. And where are you located if people want to check you out, come visit you?
We are in London, Ontario. I'm going to make sure I say that because I had an instance where somebody thought we were in Waterloo because we're on Waterloo Street.
Okay, yeah.
So we're on 240 Waterloo Street,
in London.
Suite 104 in London.
Yeah.
And we're happy to be, be there for everybody. It's at the London Roundhouse. I think people are familiar with that building. It's pretty iconic.
Yeah.
Used to be a rail station. They repair railway cars there.
Cool.
So they've kept some of the architecture. It's pretty nice.
Yeah. Well, next time I'm in London, I'm going to come check it out. I've heard it's beautiful. My husband went and he said it's a beautiful facility inside. So as we've talked about, you really help restore people's quality of life. Like you said, what their vision is, riding their bike with their children, having energy to move through their day, do what they're passionate about. What does living a flourishing life look like for you? The show is called Flourish and Flow. So what does that mean for you?
For me, that means being able to do what you truly love doing. Personally, myself, I love to work out. I love to ride my bike with my family, my wife and my son. And just being able to do what's on your mind, what you're passionate about, what you care about doing. Work is a big part of my life. It's everything. And the little bit of time outside of work that I have is family time. Yeah. So it's, for me, I don't watch any TV, zero TV. I'm going to watch this interview.
Yeah, I was like, are you going to watch this?
And I spend a lot of time studying and being with my family. So it's about doing the things you love, and that's what I'm doing. So I'm lucky.
Yeah. So having the energy to do what you're passionate about, but also, have the energy to go home, and that's important to me too, like to go home and have the energy, the presence to play with my son, right? It's not just wasting or giving all of our energy to one place. But yeah, I love that answer.
Super important.
Something that we like to do on the show at the end is called lightning round. So some fun pop questions. Well, fun for me, hopefully fun for you too. First thing that comes to mind, first answer that comes to mind.
Sure.
Coffee or tea to start your day?
Coffee always.
Yeah.
And all day.
And all day.
And all day long.
All right. How do you drink your coffee?
Nothing in it. Black, yeah. Black organic coffee.
All right.
That's it.
Early bird or night owl?
Early bird.
What's your go-to way to relax after a long day?
It sounds funny because you'd think you'd want to rest, but I work out. Like for me, it's a release. It's endorphins are released. I feel great. At the end of the day, I work out at night. When everybody's sleeping, I'm pushing weights. So.
Okay.
Yeah.
All right. If you could have dinner with any historical figure, who would it be?
That's a good question. There's so many people.
Yeah.
I think, I'm going to pick my mentor, Dr. Carrick. I'd go back and sit down at the dinner table after years of being away. I haven't seen him since he trained me back in 2000.
Yeah.
So that's 25 years. And for me, picking his brain would be amazing because what has he learned in 25 years? The man's a genius. So.
A book, do you have a book that you recommend to people, or one of your favorite books?
I was going to tell you a neurology textbook, but Patein's neurology textbook. It's what I spend my time reading.
Okay.
For leisure, the name escapes me. It's Marcus Aurelius. I think it's, I can't remember the title.
Okay.
But it's an old book. Yeah.
Well, you gave the
I think so.
author.
I hope so. I hope I got the right name.
Do you have a hidden talent or something most people don't know about you?
Do I have a hidden talent? It's not necessarily a hidden talent, but I enjoy music and I play the guitar and I like to write musical pieces, and yeah, that's another way that I relax.
Yeah, well, that's a great one. I wouldn't have pegged you for a guitar player, but good to know. Thank you so much for coming on the show. It's been a pleasure to, learn more about all that you do, and people can find you in London, Waterloo Street, Cerebral Health and Spine Center. Thank you again for being on the show. And on behalf of our show sponsors, a big thank you to Jen from Hometown Style, which we are located here today, Bree and Kyle from Bree's Fresh Market, and Laura from Escape Salon and Spa. Until next time, may you continue to flourish and find your flow.